The equine mastication cycle depends on a complex relationship between the incisor arcades, the molar arcades, and the temporomandibular joint. Acting together, these three components create the dynamic jaw movements that make up the chewing cycle and that create the specialized shapes and angles of the teeth. The chewing cycle is divided into 3 phases or strokes: opening, closing, and power. During the opening stroke, the mandible opens and moves laterally and rostrally to position the molar arcade for grinding food. During the closing stroke, the mandible moves dorsally and medially, and the molars initiate contact. During the power stroke, the jaw moves medially while continuously maintaining molar contact. This phase begins at the point of initial molar contact and then travels across the mouth through the neutral position and ends with cheek teeth contact being made on the contralateral side of the mouth. The mandible then returns to the neutral position, or the cycle repeats. A dissertation on food processing in horses, published in 1994 by Melinda Collison, showed that the path of the mandible during the power stroke approximates the direction of the transverse ridges. Collison also discovered that tooth velocity is directly proportional to the distance from the temporomandibular joint, while tooth force is inversely proportional. This means that during chewing, the premolars will develop more velocity than the molars, while the molars will generate more occlusal force than the premolars. Normal horses will typically complete 11 cycles per 10 seconds of chewing. As food is processed, it forms into a roll or rope of material quashed between the hard palate, tongue, and cheek teeth arcades. The oval chewing action, coupled with the transverse ridges on the cheek teeth and the soft tissue ridges on the roof of the mouth, guide food to the back of the mouth where it is swallowed. Studies have shown about 70% of horses tend to chew more on one side than the other. However, examinations of cheek teeth occlusal surfaces show equal wear in the majority of horses, suggesting a low correlation between dominant side chewing and normal wear patterns. Abnormal wear patterns are usually found in horses with incisor or cheek teeth malocclusions, temporomandibular joint pain, periodontal disease, or other painful conditions of the mouth. During chewing, the mandible normally moves to some extent in the rostral caudal direction. This motion can be demonstrated by raising and lowering the horse's nose. When the nose is pointed downward, the rostral edges of the upper and lower incisor arcades should be even. Raising the nose to eye level will cause the mandible to move caudally along the incisor tables from 2 mm to 10 mm. If caudal movement of the jaw is absent, possible causes include the presence of excessive transverse ridges, temporomandibular joint damage, or an imbalance in the incisor occlusal tables. To determine if incisor arcade occlusal tables are normal, a variety of references can be used. The first general guide is to elevate the incisors up to the horse's eye level. When viewed directly from the front and the sides, a normal incisor arcade table should be flat and parallel to the ground. In this position, malocclusions such as smiles and slants will also be easier to detect and diagnose. Another useful guide is to compare the incisor tables with the slope of the facial crest. In general, the two angles will be approximately parallel to each other. However, in some horses, the slope of the facial crest may deviate from the incisor slope by several degrees. Another useful reference guide is the lower bars. Viewed from the side, the slope of the incisor occlusal surface from front to back should be approximately 15 degrees to the lower bars, usually with a normal deviation of 2 degrees. Angles outside the normal deviation are an indication for further examination of the mouth. To date, the most accurate guide for determining incisor arcade table normalcy is the Incisor TMJ Line of Self-Determination. Developed by Dr. B.A. Rucker, this guide is based on the relationship discovered between incisor tables and the temporomandibular joint. Examinations of normal equine skulls demonstrate that a line drawn from the incisors, traveling caudally along the same plane as the incisor slope, will pass cleanly through the temporomandibular joint. Because this line derives from a fundamental anatomy relationship, it is self-determining for each horse and equally effective on adult horses of all breeds and sizes. If the rostral caudal slope of the incisors is in need of adjustment, then this line can serve as a visual guide. When the incisor slope is maintained parallel to this line, rostral caudal motion of the mandible does not cause the temporomandibular joint to open or close. The excursion to molar contact test measures the distance that the mandible must travel laterally to cheek teeth contact. This test, taken separately for both the left and right side of the mouth, approximates the incisor contact portion of the chewing cycle. Performed during a routine dental examination, EMC tests are valuable in determining the state of incisor and molar occlusion. And although manual manipulation of the mandible does not fully duplicate the chewing motion, the distance measured is both highly repeatable and a good indicator of percent incisor versus molar contact. The procedure begins by taking position directly in front of the horse with its teeth elevated to eye level. Using both hands, separate the horse's lips and expose the upper and lower incisors. Maintain steady pressure to keep the horse's head stabilized and to prevent the incisors from unintentionally separating. With the incisors exposed, push the mandible laterally to one side until the cheek teeth make contact. It is usually easier to perform this motion by pushing the mandible away rather than pulling towards you. Once the molars make contact and the jaw cannot move further without the incisors separating, measure the distance that the mandible has moved using the center of the upper and lower arcades as reference points. Record this distance on a dental chart using either millimeters or centimeters with 1 decimal place. Then let the jaw return to the neutral position and repeat the test on the opposite side of the mouth. Normal EMC values are based on average measurements taken from 850 adult horses. Of the horses measured, the range of values fell between a minimum value of 4 millimeters and a maximum value of 30 millimeters. From these measurements, the mean EMC value was found to be 12.3 millimeters, with the standard deviation of 3.1 millimeters. Values that lie beyond 3 standard deviations are an indication to closely examine the mouth for imbalances, malocclusions, and abnormal wear. Unequal EMC measurements that differed by more than 2 millimeters were found in 7% of horses. Normal horses will have EMC values that are either equal or differ by less than 2 millimeters. When left to right EMC distances vary by more than 2 millimeters, this is often an indication of the presence of malocclusions and should be followed up by a detailed inspection of the mouth. Since EMC measurements are made with the incisors in an elevated position, the caudal shift of the mandible can result in minor malocclusions initiating cheek-teeth contact sooner. These malocclusions often become evident in unequal EMC values. The distance that the incisors are in contact during the power stroke of the chewing cycle can be found by adding the left and right EMC distances together. In addition, the maximum EMC value can also be considered with Collison's measurements of excursion. Under Collison's study, the mean maximum excursion during chewing, regardless of the fiber level of the diet, was recorded at 44 millimeters with a standard deviation of 5 millimeters. The angle of molar occlusion is the composite angle on which the jaw moves during molar contact. Also known as the transverse or buccolingual plane angle, determining this angle is valuable in performing incisor reductions and can serve as a guide for determining how incisor reductions will affect EMC. The occlusal angle of individual teeth can vary from the front to the back of an arcade. The normal range of occlusal angles has been measured to be from 10 degrees to 18 degrees, with difficulty in chewing often noted when the angle falls outside these limits. To date, no instrument is commercially available for measuring the angle of the entire arcade. In order to calculate the angle of molar occlusion, a trigonometric formula must be used. Calculating the occlusal angle is a 2- or 3-step procedure. The procedure begins by exposing and stabilizing the incisors with the hands. If the center of the lower incisors does not rest directly below the center of the upper incisors, mark the spot on the upper incisors where the mandibular incisor center point is positioned. Next, push the mandible sideways to molar contact. With the jaw in this position, place 2 marks on the upper incisors. Place the first mark on the point where the center of the mandible has stopped. Then place the second mark at exactly 1 centimeter lateral to the first mark. Once both marks have been made, push the mandible further laterally until the center of the mandible lies directly under the 1 centimeter mark. This will cause the incisors to separate. Measure the amount of incisor separation in millimeters and record the value on a dental chart. To calculate the angle of molar occlusion, take the measurements of incisor separation and molar excursion and use them to construct a right-angled triangle. Here the measurement of incisor separation becomes line A, and the 1 centimeter excursion measurement becomes line B. The hypotenuse, which connects the ends of the measured lines, represents the occlusal surface of the molar arcade, with the AMO represented as unknown angle x. Through trigonometry, the AMO can be calculated with the formula Tangent of angle x is equal to the opposite side over the adjacent side. In this formula, line A will become the opposite side and line B will become the adjacent side. If line A is 3 mm and line B is the 1 cm excursion standard, then unknown angle x can be found by solving the equation for x. In this example, tangent of angle x is equal to 3/10 or 0.3. To solve for x, calculate the inverse tangent of 0.3. The resulting value will be the angle of molar occlusion. Another method for finding the AMO is the use of a trigonometry chart. The following chart, based on the 1 cm excursion standard, indicates the corresponding AMO for each millimeter of incisor separation. Normal AMO for adult horses falls within the range of 10 to 18 degrees, which corresponds to an incisor separation between 1.8 and 3.2 millimeters. Of the horses studied, the minimum value for incisor separation was recorded at 1 millimeter, while the maximum value